Bacterium tuberculosis is the causative agent of tuberculosis, a contagious infectious disease that has been increasing due to many factors, such as the HIV pandemic. About 5 to 10% of people infected with TB will eventually get symptoms and develop TB disease. A total of 1.3 million people have died from TB in 2022. Worldwide, TB is the second leading infectious killer after COVID 19. Mycobacterium tuberculosis was first discovered in 1882 by Robert Koch. The disease was also known as Koch's bacillus. His investigations into the etiology of tuberculosis uncovered the pathogen. Due to his achievements in the field, Koch was considered the father of the scientific study of tuberculosis. In addition, he introduced tuberculin, which was proven to be ineffective as a cure but became very important part of diagnostic testing and management of tuberculosis. Mycobacterium tuberculosis enters the body through inhalation, and humans are the only known reservoir. Most commonly, it will affect the respiratory system, but other body systems may become involved, such as the GI system, the central nervous system, musculoskeletal system, and the liver. The bacterium has a myocyalic acid to its outer shell wall, which makes it resistant to quick immune detection. Tuberculosis is highly aerobic and requires high levels of oxygen to survive. In addition, the portal of entry and exit will be via mouth, nasals, breaks in the skin, and other mucous membranes. When TB is inhaled, it passes into the smallest and lowest parts of the airways. Furthermore, the mode of transmission is by coughing and sneezing, releasing the bacterium. TB infection happens in 4 stages: the initial macrophage response, the growth stage, the immune control stage, and the long captivation stage. In addition, these 4 stages will happen over the course of 30 days.
Tuberculosis exerts a diverse impact on organs and organ systems, extending beyond the respiratory system. In pulmonary TB, the primary manifestation are the larynx and trachea, leading to extrapulmonary TB. The dissemination through lymphatic channels can result in lymphadenitis, affecting regions such as the neck, abdomen, and groin. TB's involvement is not limited to the respiratory and lymphatic systems. It can also extend to the central nervous system, causing meningitis and the formation of tuberculomas in the brain and spinal cord. Skeletal TB, known as Pat's disease, affects the spine and hips and knees. TB can manifest also in organs such as kidneys, GI tract, and genitourinary system. These systemic involvements underscore the complexity of TB and its potential to impact multiple organ systems. Tuberculosis poses a multifaceted global dilemma with a pronounced burden in low and middle income nations. Fluctuations in TB incidence are influenced by diverse factors such as socioeconomic status, access to health care, and prevalence of risk factors within populations. The emergence of the drug-resistant TB strains, notably MDR-TB, and extensively XDR-TB, amplifies the complexity of the situation. These resistant strains demand prolonged treatment regimens and are linked with heightened mortality rates, emphasizing the critical need for robust interventions. TB-HIV co-infection complicates disease management, leading to adverse outcomes and posing additional hurdles in disease control efforts. A holistic approach addressing both medical and social determinants is essential for effective TB and prevention on a global scale.
Now let us move on to signs and symptoms. First, let's talk about latent TB. Latent TB, there is no clinical symptoms, but if you get tested for TB skin test or blood test, it will show positive result. And the TB bacteria cannot spread to other people. Latent TB, it can remain inactive for a lifetime, but if the individual doesn't have strong immune system, it can go from inactive to active. Active tuberculosis. For active tuberculosis, the individual will feel fatigue, tiredness, persistent coughing with phlegm or coughing with blood, chest pain, loss of appetite, weight loss, and fever. And during nighttime, they can also feel night sweat. Thank you. Now let us move on to morbidity and mortality rate reported in the United States in 2021. In 2018, there was 8,998 TB cases reported and 542 TB death cases. In 2019, there was 8,809 TB cases, which is 1.6% lower, and 526 TB death cases, which is 3.4% lower compared last 2018. In 2020, there was 7,171 TB cases reported, which is 20.2% lower compared to 2019, and 600 death cases, which is 13% higher compared to 2019. In 2021, there was 7,882 TB cases reported, which is 9.8% higher compared to 2020, and there were 602 reported death cases due to tuberculosis.
Treatment for Mycobacterium tuberculosis will depend on whether a patient has latent or active infection. Latent infection is when the bacteria is present in the body but there are no indications of TB and is not contagious at all. This occurs when the immune system inhibits the bacteria from growing. Treating a latent infection can prevent an active infection, and providers may prescribe an antibiotic to be taken over a course of 3 to 9 months. Active infection is when the bacteria multiplies, leading to indications such as chronic cough, chest pain, and can be contagious. Antibiotics are given for those with an active infection, but doses may be increased and taken for an extended period of time compared to latent infection. As you can see in the picture, active TB is when TB bacteria are awake and you will feel unwell, and you could pass the TB to other people. Some symptoms include cough, fever, weight loss, loss of appetite, night sweats, and tiredness. In latent TB are asleep, and this is when you're okay and you do not feel unwell, and you cannot pass TB to others in this way. And with this, you have 1 in 10 chance of developing an active TB if you don't treat it with antibiotics. Some antibiotics can cause side effects ranging from nerve, liver, or eye damage. Mycobacterium tuberculosis also may become antibiotic resistant, and patients may develop drug-resistant TB, but there are longer and higher doses of antibiotics available to address drug-resistant TB. It is paramount to complete the full course of antibiotics. The chances of bacteria surviving increases the likelihood of drug resistance, which causes recurring illnesses, lessens the efficacy of antibiotics, and is contagious. As you can see on the image on the left, drug-resistant tuberculosis remains a public health crisis, and about 0.5 million people feel ill with drug-resistant TB. Only 1 in 3 people access treatment. Common antibiotics to address Mycobacterium tuberculosis are rifampicin. Rifampicin is an antibiotic used to treat several types of mycobacterial infections, such as Mycobacterium avium complex, leprosy, and can be used in combination with other antibacterials. Side effects of this medication include hepatotoxicity, nausea, dyspepsia, abdominal pain, and rash. Isoniazid is also an antibiotic used to treat mycobacterial infections, most commonly paired with other antimycobacterial agents and specifically used to treat active or latent tuberculosis. Hepatotoxicity, peripheral neuropathy, optic neuritis, and hepatitis are one of their common side effects. Pyrazinamide is a highly specific antibiotic that is only active against Mycobacterium tuberculosis. This antibiotic kills and stops the growth of the specific bacteria. Side effects include gastrointestinal disturbance, hepatotoxicity, and gout. To reduce the risks of acquired tuberculosis, prevention techniques include following your doctor's prescribed health plan if with latent infection, avoiding extended contact with people that have active infections, and wearing an N95 respirator mask when exposed to Mycobacterium tuberculosis. Vaccination for TB is not usually recommended in the US. However, according to the Centers for Disease Control and Prevention, otherwise known as CDC, there is a low risk of Mycobacterium tuberculosis in the US. It could still be administered to those with high risks of exposure, such as healthcare workers or patients exposed to drug-resistant TB.
According to the National Institute of Health, some patients were treated for tuberculosis in the year of 2023. After 6 months of completing the treatment, they did have a few outcomes. For example, there was 19% of patients that were cured, 69% fully completed the treatment, 1.5% failed the treatment, 3.5% were uncompliant, and 5.75% resulted in death. So this does vary depending on if a permanent regimen might be necessary as well. That's when it becomes crucial to monitor these patients to assure that the treatment is not becoming drug resistant as well, which can happen from automatically taking the regimen for too long as well. In conclusion, tuberculosis is treatable. It is something that a patient can overcome. This is all just based on the treatment as discussed earlier today. It is with proper education as well of tuberculosis, and a very compliant patient will overcome this much better, but we of course need to make sure that we do monitor all patients with tuberculosis to assure that the treatment is being completed and that there are no unexpected occurrences in which the antibiotic will not be doing the same effect that we would like it to have as well on tuberculosis.